Diabetes is a metabolic disease in which the body's inability to produce any or enough insulin causes elevated levels of glucose in the blood. Did you know that 90% of diabetics have health insurance? That leaves 10% without health insurance. There are many types of insurance. Make sure you find the one that fits you.
Oh man!
What's wrong?
I didn't know that there were diabetics that didn't have health insurance!
Oh yeah, it's true. I would know. I'm one of them.
What?
Well, I'm looking at different healthcare coverage, but it's so confusing.
Well, I can help you. I'm a health administration major and I know all about it, including Affordable Care Acts, income qualifying for benefits, job-based, and individual-based plans. You have to provide insurance and you can't refuse treatment. There's 4 other sections of insurance.
Wow, I didn't realize that I had all of those options. I'll have to look into it some more.
There's a class later today in the science building that discusses how other majors relate to diabetes and health insurance if you want to go check it out.
Hey, let's go!
Because clap along if you feel like a room without a roof. Because clap along if you feel like happiness is the truth.
Man, I'm really excited about this class. I don't know about you, but
I am too. I can't wait for it.
I mean, I'm a human development and family studies major, and you're a
Dietetics major.
and I think that it's just gonna be really cool just to see how our majors combined can
mesh
help.
together,
Yeah, with health insurance and diabetes. Like, I
It's
never
gonna
would
be
have thought.
great.
Yeah.
I'm so excited. I can't wait to see what my major does, what your major does, how we both work together for it. It's gonna be great.
Let's go learn about it.
All right, let's go.
Everybody, please take your seats. All right, class, any questions on what we learned on Monday? Ashley?
I'm a human development and family studies major, and I don't really know how that pertains to health insurance and diabetes. Can you kind of go over that?
With your major, your job is to be an educator. You can explain how this issue affects families both as a whole and individually. What are obstacles for families, how it can affect kids, as well as resources for parents so that they can help their kids or other family members with diabetes.
Oh wow, I never would have thought of that.
You learn something new every day.
Well, I read a study that said that not all care is the same for different patients in the healthcare setting, and it depends on their health insurance. And I know as dietetic students, we strive to give equal care to all of our patients so that way they'll learn to control their diabetes.
There has been a variety of care given, there shouldn't be. All care should be given equally to all patients regardless of their health insurance.
Yeah, because I know that my community nutrition professor is always saying that as dietitians, we should make sure we're giving each of our patients the same quality of care.
You are. Any more questions or comments on health insurance in the workplace? No? Okay. Then now we are going to turn our attention to today's quiz. Everyone get out a piece of paper. Today's quiz question is, why is it important to work together in the workplace?
It's important for everyone in the healthcare setting to work together because at the end of the day, we're there for the client's benefit.
I think if we don't act as a cohesive unit in our healthcare system, then honestly our clients will experience a downfall. I think our clients really depend on us as professionals to be professionals and to, I mean, they experience a downfall, so I think that if we don't act as professionals, then they're the ones that are at loss.
I know that there can be restrictions on what patients can afford in terms of treatment and the coverage plans that they have, but that doesn't mean that they should get poor quality of care. In fact, I think that it's our job to work even harder in these cases so that we can provide these patients with the best care possible, because we're there to ensure the healthiest outcomes for every patient we treat every day, regardless of our feelings or preferences toward each other.
So, it is very important for individuals with diabetes to figure out what healthcare coverage is right for them. I know there are a couple options out there, but we encourage you just to find the one that fits you. And also, it's very important for people with human services majors or health administration or dietitians to all work together because our patient is what is most important.